Hello and welcome to my channel. In this video we will be looking at caregiver-infant interactions, which you need to know for AQA A-level psychology in the subtopic of attachment. I hope you enjoy this video and find it helpful. Let's get started. An attachment can be defined as a close two-way emotional bond or tie between two individuals in which each individual sees the other as essential for their safety and own emotional security. An infant cannot speak with a caregiver to develop an attachment bond, so instead there are several ways infants and caregivers can communicate to help develop an attachment between them. Imitation is when an infant mimics or copies a caregiver's behavior. Sensitive responsiveness is when an adult attends sensitively to infants' communications. Separation distress is when an infant shows signs of anxiety when their attachment figure leaves their presence. Secure-based behavior is when an infant regularly returns and makes contact with their attachment figure while playing. Reciprocity. Reciprocity is a two-way, mutual interactional process between a caregiver and an infant, where the caregiver and infant take it in turns to elicit and respond to the other's signals and behaviors to sustain an interaction. These kinds of reciprocal interactions strengthen the emotional connection between infant and caregiver. For example, smiling by the caregiver results in smiling by the infant. Tronick et al., 1979, conducted a laboratory study, known as the still face experiment. In the study, mothers were instructed to interact with their infants normally, then suddenly stop responding and maintain a still face expression, showing no emotion or responsiveness to the infant. This phase aimed to observe how infants reacted to the sudden change in their caregiver's behavior. After this period, the mothers resumed normal interaction to study how infants responded to the return of responsive caregiving. The interactions were recorded and the responses from the infants were noted. They found that when mothers who had been engaged in dialogue with their infants were asked to stop moving and remain static, the infants would become puzzled and distressed when their smiles were unable to provoke a reciprocal response. This suggests that infants are not passive recipients but actively participate in shaping their social interactions. A strength of Tronick's study is that it effectively demonstrates the impact of caregiver responsiveness on infant behavior and emotional regulation. The study involved mothers interacting normally with their infants, then suddenly becoming unresponsive and maintaining a still face expression to observe infants' reactions. This experimental design allowed researchers to highlight the importance of consistent interactions in infant development and how disruptions in caregiver responsiveness can affect infant behavior and emotional well-being. This is a strength because it suggests that consistent caregiver responsiveness plays a crucial role in shaping infants' emotional development and behavior, highlighting the significance of maintaining engaging and responsive interactions with infants for their overall well-being and social-emotional growth. A limitation of Tronick's study is that it is subjective. Only an inference could be made as to whether the baby was showing signs of distress, as an infant is not able to verbally express to anyone that they are distressed, and it is not possible to directly ask the infant if they are distressed. Therefore, the infant's behaviors and intentions cannot be accurately interpreted due to their limited ability to communicate directly. Infants' movements, such as subtle hand gestures or changes in expression, can have varied interpretations, making it complex to decipher their responses solely based on observable behaviors. This is a limitation because it suggests that the subjective nature of interpreting infants' behaviors in studies like Tronick's can introduce potential biases and uncertainties into the analysis, affecting the reliability and validity of the study's conclusions. Interactional synchrony. Interactional synchrony is a simultaneous and coordinated sequence of movements, communication, and emotions, such as hand and facial gestures between a caregiver and an infant, where the caregiver and infant mutually mirror and respond to each other's social behaviors to sustain communication. These kinds of synchronous interactions strengthen the bond between infant and caregiver. For example, a caregiver may pull a funny face, the infant may laugh and then the caregiver may laugh back. Meltzoff and Moore, 1977, carried out a study into interactional synchrony between an adult model and infants of 2 to 3 weeks. The adult model displayed one of 3 facial expressions or one of 3 hand gestures, for instance opening their mouth, poking tongue out, frowning and waving a finger. A dummy was placed in the infant's mouth to prevent any response in the initial display. After the display, the dummy was removed, and the child's expression was filmed and labeled by an independent observer. They found that there was an association between the infant's behavior and the adult model. In a later study, they did the same study with infants only 3 days old. They concluded that the fact that infants this young were displaying the behavior ruled out the possibility that the imitation behaviors are learnt. A strength of Meltzoff and Moore study is that the observation is well controlled. Meltzoff and Moore study is able to capture the microsequences of interaction processes, as it was conducted in a laboratory setting. This means that other activity that might distract a baby, such as noise, smells and pictures, can be controlled. This is a strength because it suggests that the controlled environment of the study enabled a focused analysis of the interaction processes between caregivers and infants, leading to a more precise understanding of early social exchanges without external distractions. A strength of Meltzoff and Moore's study is that there is a reduced chance of demand characteristics. The infants that participant in the study did not know they were being observed and therefore were unable to change their behavior in response to the observation. This is a strength because it suggests that the study conducted by Meltzoff and Moore effectively minimized demand characteristics by ensuring that the infants participating were unaware of being observed, thus reducing the chances of their behavior being influenced by the knowledge of being studied. A strength of Meltzoff and Moore study is that the observation has high inter-rater reliability. The observation was filmed, which meant that the recording could be watched back later by other observers and analyzed. On top of this, the observer who labeled the type of behavior displayed was independent and not related to the study. This means that it was double-blind, as the observer did not know the aim of the study. This is a strength because it suggests that the study's rigorous method of using independent observers and maintaining double-blind procedures enhances the objectivity and reliability of the observations, contributing to the credibility of the study findings. A strength of Meltzoff and Moore study is that there is research to support their findings and conclusions. Isabella et al., 1989, conducted a study where they observed 30 mothers and babies together and assessed the degree of synchrony. The researchers also assessed the quality of the mother-baby attachment. They found that there were higher levels of synchrony between caregivers and infants who had a good emotional intense relationship and a secure attachment type. They concluded that interactional synchrony is important for the development of caregiver-infant attachment and can predict the development of a good quality attachment. This is a strength because it suggests that the presence of research supporting the relationship between interactional synchrony, emotional intensity, and secure attachment reinforces the significance of caregiver-infant interactions in influencing attachment quality and development. A strength of Meltzoff and Moore study is that there is research to support the idea that infants display specific social responses. De Jong et al., 1991, observed infants when they interacted with 2 objects. One simulated tongue movements while the other simulated the opening and closing of the mouth. They found infants within the median age of 5 to 12 weeks made little interactional synchrony or response to the objects. This suggests infants do display specific social responses to human interactions, as interactional synchrony suggests, as they do not simply imitate everything. This is a strength because it suggests that the research findings, such as those from De Jong et al., 1991, provide valuable insights into how infants demonstrate specific social responses, indicating a more nuanced understanding of infant behavior beyond mere imitation in social interactions. A limitation of Meltzoff and Moore's study is that testing infant behavior is incredibly difficult as their facial expressions always continuously changing. Behaviors observed in the Meltzoff and Moore study involving sticking their tongue out, yawning, smiling, opening their mouths and movements their hands occur constantly in young children. This makes it incredibly difficult to distinguish between general behavior and actual interactional synchrony. This is a limitation because it suggests that the dynamic nature of infant behavior, as observed in the Meltzoff and Moore study, poses challenges in distinguishing between spontaneous actions and true interactional synchrony due to the continual changes in facial expressions and the prevalence of common behaviors in young children. A limitation of Meltzoff and Moore's study is that it suffers from cultural bias. Levine et al., 1994, found that Kenyan mothers had little interactions with their infants, yet a high proportion of them were still classed as securely attached. This suggests that interactional synchrony is not innate or necessary to form an attachment. This is a limitation because it suggests that the cultural context plays a significant role in shaping attachment dynamics, as indicated by the findings of Levine et al., 1994, which question the universal applicability of interactional synchrony in attachment formation proposed by Meltzoff and Moore. A limitation of Meltzoff and Moore's study is that there are psychologists who contradict their findings. Piaget, 1962, believed that true imitation developed at the end of the first year and anything before this was response training, infant repeating behavior that was rewarded a result of operant conditioning. Piaget believed the infant's behavior was pseudo-imitation, the infant had not consciously translated what they see into a matching movement. This is a limitation because it suggests that psychologists like Piaget, 1962, have differing views on infant behavior, with Piaget proposing that what Meltzoff and Moore observed might be more related to response training rather than true imitation, indicating a discrepancy in the interpretation of early infant behaviors. Caregiver-infant interactions has several strengths and limitations. A strength is that research into early caregiver-infant interaction has practical applications in parenting skills training. For example, Crotwell et al., 2013, found that a 10-minute parent-child interaction therapy, PCIT, improved interactional synchrony in 20 low-income mothers and their preschool children. On the other hand, research into caregiver-infant interaction is socially sensitive because it can be used to argue that when a mother returns to work soon after having a baby, this may risk damaging their baby's development. This is a strength because it suggests that research on early caregiver-infant interaction, such as the study by Crotwell et al., 2013, on parent-child interaction therapy, PCIT, has practical applications in parenting skills training, as demonstrated by the positive impact on interactional synchrony observed in low-income mothers and their preschool children. A strength of research into caregiver-infant interactions is that there is research to support both interactional synchrony and reciprocity in the development of a caregiver-infant attachment. Condon and Sander, 1974, conducted a controlled observation to investigate the synchrony of infant movement with adult speech, by analyzing video recordings of infants interacting with their caregivers. They found that infants did coordinate their moves and react to their caregivers through their behavior in sequenced and rhythmic ways similar and in line with the adult's speech as if they were turn-taking in a conversation. This is a strength because it suggests that Condon and Sander, 1974, study highlights the coordinated and rhythmic nature of infant movements and responses aligned with adult speech, resembling conversational turn-taking, which is crucial in understanding the development of caregiver-infant attachment. A strength of research into caregiver-infant interactions is that there is research to support the idea that behaviors displayed by infants to form an attachment are innate rather than learnt. Murray and Trevathan, 1985, found that 2-month-old infants first interacted via a video monitor with their mother in real time. Then the video monitor played a tape where the mother is not responding to the infant's facial and bodily gestures, causing acute distress in the infant. The infants tried to gain their mother's interest, but when they received no response they turned away. This demonstrated that the infant is actively producing a response rather than displaying a response that has been rewarded. This is a strength because it suggests that there is research supporting the idea that behaviors displayed by infants to form an attachment are innate rather than learned, as shown by Murray and Trevathan, 1985, in their study where infants actively produced responses rather than displaying responses that had been rewarded. A limitation of caregiver-infant interactions research is that it is difficult to determine an infant's intentions, as infants cannot communicate and therefore inferences must be drawn. Infants lack a lot of coordination, and the majority of their body is immobile. The movements and behavior that is usually observed into caregiver-infant research is normally small hand movements or subtle changes in expression, e.g. smiling could be a sign that an infant is happy, however it could also be a sign that an infant is passing wind. It is very hard to tell just by observing the difference between these two things, as the infant is not able to communicate their intentions. An observer can therefore not determine what is taking place from the infant's perspective, as a hand twitch could be a response triggered by a caregiver's behavior, however this could also be random. This is a limitation because it suggests that in caregiver-infant interactions research, determining an infant's intentions can be challenging due to their inability to communicate directly. Infants' limited coordination and immobility make it difficult to interpret their movements accurately. For instance, small hand movements or subtle changes in expression, like smiling, could have various interpretations, such as happiness or discomfort. Deciphering these signals solely through observation without direct communication from the infant makes it hard to understand their true intentions or perspective. A limitation of research into caregiver-infant interactions is that simply observing a behavior does not give a full understanding into its developmental importance. Fellman, 2012, pointed out that ideas like synchrony and by implication reciprocity simply give names to patterns of observable caregiver and infant behaviors. These are robust phenomena in the sense that they can be reliably observed, but they still may not be particularly useful in understanding child development, as these behaviors do not provide any insight into the purpose of their behaviors. This is a limitation because it suggests that while behaviors like synchrony and reciprocity in caregiver-infant interactions are observable and reliable, they may not inherently reveal the underlying purpose or significance of these behaviors in child development, as pointed out by Fellman, 2012. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.